Hello and welcome back to my channel. If you're wondering what this yellow thing is here on my face, it's something called an NG tube or a nasogastric tube, and it's a feeding tube that allows people who can't eat or who are having trouble eating to be fed through the nose and down into their stomach. So today I'm going to show you how to insert one, and if you're a bit squeamish you might not want to watch this. You might want to go and watch one of my other videos instead. But I'm going to stop talking now and get right into it. So first of all, you're going to need your NG tube, of course, a 50ml syringe, a large drink, and then just some water. So I'm going to start by opening the tube. My hands are clean. This is not a sterile procedure because, as you know, your mouth and your nose aren't clean, so it doesn't have to be sterile. So this is the tube here. It has two ports. This pink thing here is the guide wire. I usually just take this out and make sure that you can move it in and out so it's not stuck, and close it back up. And then I also just close the other side as well, it doesn't really matter. So the first thing you're going to want to do is measure how far you're going to need to put it in. So on the tube it's got some numbers here. So what you want to do is measure from the end of your chest bone, because that's roughly where your stomach is. And I don't know if you can see that on camera, but just where your chest bone ends, you want to measure up to your ear, and then from your ear to your nose, and then look at the number. On me that says 58, so as I'm pushing the tube in, I want the number 58 to be at my nose here. So I'm gonna begin, and I can't really talk while I'm doing it, so the rest might be a voiceover. If you see my eyes watering, it's not because I'm in pain or anything, it just makes my eyes water. It feels funny, something going in your nose. Yeah, it doesn't hurt, it just feels weird. You want to aim the tube straight back towards your ear, not up in the way that your nose bridge goes, because basically you'll be going straight to your brain. You want to go back towards your ear. So you want to start off slowly pushing the tube in until you can feel it at the back of your throat, and it kind of feels like it's getting stuck. And when you feel that, you need to get your drink and take a big mouthful and just keep swallowing, and at the same time push the tube as you're swallowing, just to pass the back of your throat. Right, it's gone past that point now. I can feel it down here. So I'm going to carry on drinking until I get to the point where I want it to be. The drink just disguises the feeling of the tube going down, so you're less likely to heave and be sick. So for me, drinking the cold pop just disguises the feeling. This doesn't hurt at all, it just feels really weird. You might want to have tissues and something to be sickened by the side, because sometimes it can make you heave, but I've gotten used to the feeling, so I like to just take my time and do it. Okay, I'm just checking the number now, so 58 is here. So that's where we want it, right there. And what I'm going to do now is to check that it's in the right place. So I'm actually going to put some tape on it here so I can some tape there. Right, now this is where you need your syringe. So to check that it's in the right place, and the reason why I used Ribena as a drink is because I'll be able to tell if I'm in the right place with it or not. So it's not if it's coming out, but I think it's because the guide wire is blocking. I'm pretty sure it's in the right place, so I'm going to take the guide wire out. This just makes it easier to press it down because the tube can kink inside without the guide wire, so that's what the guide wire is, to keep it straight while you're putting it in. Now you're supposed to check that it's in the right place, but because I'm awake and I'm an adult and I know it's not in my lungs, I'd be coughing and whatever, so it's pretty much in the right place, but I just need to get some Ribena back to check it's in the right place. So what I'm going to do now is just push it down a little bit further because it might not be in far enough. So I'm going to try that now. Yep, and there we go. It looks disgusting because that's my stomach contents in there. Keep going. Yeah, I have eaten as well, so it's basically food as well. So that's the evidence that it's in my stomach. Okay, so what you're going to do now is take your glass of water. Take some water, doesn't need to be a lot. Get rid of the air. And then flush your tube because you don't want it to get blocked because you'll have to do it all over again. And you should be able to feel that going down. I can feel it's cold. Actually makes you want to swallow as well. It feels like something's going down. So that's the water going in. That should do. And then you can close it back off. And then I'll normally just place it behind my ear, like so. So once you've done that, you know it's in the right place, you can go ahead and secure it. I would like to stick mine. Yep, that's it. Didn't hurt, didn't take long at all. Wasn't really messy. It's pretty easy really once you know how to do it. Okay, I'm just going to quickly show you inside of my mouth because you can see where the tube goes through my nose and at the back of my throat. So before I go, I just wanted to say that the reason for me doing this video today is that I have Crohn's disease, and although I'm not underweight now, there's been many occasions where I have been underweight and have struggled to put weight on for various reasons. And so there have been many occasions where I've had to have an NG tube, and I feel that it's a good skill to have because it's a lot more comfortable and easier process doing it yourself than having a nurse do it for you. And it can mean the difference between having to stay in hospital because the nurses have to care for your feeding tube and being able to go home where you can care for it yourself and basically be more comfortable in your own environment. So now that I'm done with this, I'm going to take it out. You can actually see how easy it is to take out as well. Basically pull this off, just pull it out. I know it's gross, but it doesn't hurt at all. So if you're still here, thank you for watching. If you haven't already, please subscribe to my channel there's other videos you can check out, and I'll see you in my next video.